Hello and welcome. Before we begin, I need to share something important with you. Everything you're about to hear is general information only. It is not personal financial advice. Your situation is unique. Always speak with a licensed financial advisor, an aged care specialist, or Services Australia before making any decisions about aged care. Now, let's get started. What happens if you can't afford aged care in Australia? This is the question that keeps people awake at night. It's the fear that sits heavy in your chest when you think about the future. It's the conversation you avoid having with your children because you don't want to burden them. It's the worry that makes you wonder if you've saved enough, planned enough, done enough. And I want you to know something right now. If you're feeling this fear, you're not alone. You're not being dramatic. You're not overreacting. This is a legitimate concern. Aged care can be expensive. The system is confusing, and the thought of needing care when you can't afford it is genuinely frightening. But here's what I want to tell you today. There are answers. There are safety nets. There are options, and you are not going to be left helpless. The Australian aged care system, for all its flaws, is designed to ensure that everyone who needs care can access it. Not always in the exact way they'd prefer, but access nonetheless. So, take a deep breath. We're going to walk through this together. We're going to talk about what happens if you can't afford aged care. We're going to look at the real options available to you. And we're going to create a plan so that this fear doesn't have to control your life anymore. Let me start by acknowledging something. The fear of aged care is about more than money. It's about dignity. It's about independence. It's about the terror of losing control over your own life. It's about the image you have in your mind of being stuck somewhere you don't want to be, unable to leave, unable to change things. And underneath all of that is a deeper fear, the fear of being a burden, the fear that your children will have to sacrifice their own lives to care for you, the fear that you'll drain the savings you worked so hard to build, the fear that you'll leave nothing behind for the people you love. I see this fear every single day. People in their 50s and 60s already worrying about aged care. People in their 70s and 80s lying awake calculating costs. Adult children stressed about how they'll support their aging parents while still raising their own families. And the worst part? Most of this fear comes from not understanding the system, from hearing horror stories, from seeing shocking news reports about aged care costs, from knowing someone who paid hundreds of thousands of dollars and wondering how on earth they'll ever afford the same. So, let me be clear about what we're doing today. We're shining a light into that dark corner where the fear lives. We're going to look at it directly. We're going to understand it, and we're going to take away its power over you. Because here's the truth. Yes, aged care can be expensive if you have significant assets. But if you don't have those assets, if you genuinely cannot afford the costs, the system does not abandon you. You will not be left without care. You will not be turned away. There are protections in place. There are subsidies. There are supported places. And we're going to talk about all of them. Now, let's talk about context. Let's talk about how we got here, because understanding where we've been helps us understand where we are. Think back to the Australia of 30 or 40 years ago. Aged care was different then. Nursing homes were often run by churches or charities. The government subsidized them heavily. The costs to residents were relatively low. Most people could afford it on their pension, and many people never went into aged care at all because families cared for elderly relatives at home. That was just what you did. There was less choice back then. You didn't pick from dozens of facilities based on amenities and location. You went where there was a bed available. You took what you could get. But for most people, affordability wasn't the primary concern. The system was designed to be accessible. Then things started to change. Australia's population was aging. People were living longer. Medical advances meant people could survive conditions that would have been fatal decades earlier. Suddenly, the demand for aged care was growing rapidly. The old system couldn't keep up. The government needed more capacity, more beds, more facilities, so they encouraged private investment. They created a mixed market of government-subsidized places and privately run facilities. They introduced user pays principles. The idea was that those who could afford to contribute should contribute. That would free up public resources for those who couldn't. In theory, it made sense. In practice, it created complexity. Suddenly, there were different types of fees: accommodation payments, daily fees, means-tested care fees, refundable accommodation deposits that could be hundreds of thousands of dollars. The system became harder to navigate, and the costs for many people became genuinely frightening. Add to that the economic reality of modern Australia. Property prices skyrocketed. A house you bought for $50,000 in the 70s might now be worth $1 million. That's wonderful if you want to sell, but it also means you're asset-rich and potentially cash-poor. You own a valuable home, but you're living on the age pension. And when it comes time for aged care, that home value affects what you pay. Then there's superannuation. The generation retiring now is the first to have had compulsory super for most of their working lives. That's good. It means more people have retirement savings. But it also means more people have accessible assets when they enter aged care, so they're expected to contribute more. And let's talk about the cost of care itself. Healthcare has become more expensive. Staffing costs have increased. Aged care workers, rightly, are demanding better wages. Facilities need to meet higher standards. All of that costs money, and someone has to pay for it. The result is the system we have today, a system where some people pay hundreds of thousands of dollars to enter aged care, while others pay very little. A system where your assets determine your fees. A system that's fair in principle, but confusing and stressful in practice. And this brings us to the question at hand. What happens if you can't afford it? What happens if you don't have hundreds of thousands of dollars? What happens if you're already struggling financially and then you need care? Let's start with the basics. Let's talk about how aged care fees actually work, because you can't understand the safety nets until you understand what you're paying for. When you enter residential aged care in Australia, there are 3 main types of fees. Let's break them down one at a time. First, there's the accommodation payment. This is the cost of your room. Think of it like rent, but structured differently. The facility sets a price for the accommodation. This can range from nothing at all for supported residents to several $100,000 for premium rooms in expensive facilities. Now here's the key part. You can pay this as a lump sum, called a refundable accommodation deposit, or RAD, or you can pay it as a daily fee, called a daily accommodation payment, or DAP. Or you can do a combination of both. If you pay the lump sum, that money is refundable when you leave the facility. It's not lost, it's not a purchase, it's held by the facility and returned to you or your estate later. While they hold it, they can use it, but you get it back. If you pay the daily fee instead, you're essentially paying interest on the lump sum you didn't pay. The facility calculates what you'd be charged per day to rent that room. This comes out of your income or assets on an ongoing basis. Most people do a combination. Maybe you pay part as a lump sum and part as a daily fee. That spreads the impact. Second, there's the basic daily fee. Everyone pays this. It doesn't matter how much money you have. This covers things like meals, cleaning, laundry, heating, cooling, the basics of living in the facility. This fee is set as a percentage of the single-age pension. Currently, it sits at a percentage around 85% of the base pension, so it's affordable for most people because it's tied to pension income. Third, there's the means-tested care fee. This is where your assets and income matter. If you have significant assets or income, the government says you should contribute more toward the cost of your actual care, the nursing, the medication management, the therapies. This fee is calculated based on a means test, similar to how the age pension is calculated. The more you have, the more you pay. But there are caps. There are annual limits and lifetime limits, so you're not paying forever without end. Now, those are the three main fees. But here's what's crucial. If you have low assets and low income, you might pay nothing for accommodation. Zero. The government subsidizes your accommodation fully. You become what's called a supported resident. And the means-tested care fee, if you don't have the assets or income, you don't pay it, or you pay very little. So in practice, if you're on a full-age pension with minimal assets, your only cost might be the basic daily fee. That's it. That's all you pay. And because that fee is set as a percentage of the pension, it's designed to be affordable. You'll still have money left from your pension for personal expenses. Does that mean you get a lesser quality of care? No. The government subsidy covers your accommodation and care costs. You access the same care standards as everyone else. You're protected by the same quality regulations. You're not a second-class resident. Now, you might be thinking, okay, but what if I have some assets but not enough to pay the full accommodation price? What then? That's where the system gets nuanced. There are asset and income thresholds. If you're below a certain threshold, you're a supported resident and you pay nothing for accommodation. If you're above that threshold but still don't have enough to pay the full accommodation price, you pay what you can. The facility must accept you as a supported resident if you meet the criteria, even if they'd prefer a resident who can pay the full amount. This is important. A facility cannot refuse you on the basis that you can't afford the full accommodation price. If you're assessed as a supported resident, they must accept you. There are laws protecting this. Your financial situation cannot be a barrier to accessing care. Now, let's talk about a scenario that worries people deeply. What if you've got some assets, but you've also got a spouse still living at home? You're worried that paying for your aged care will leave your partner with nothing. What happens then? The system has protections for this. When you enter aged care and your spouse remains at home, the family home is protected. It's not counted in your aged care means test while your spouse lives there. Your spouse's income and assets are assessed separately. They're not expected to impoverish themselves to pay for your care. There are rules about how assets are divided for assessment purposes, but the principle is clear. Your partner at home is protected. They keep the home, they keep enough assets and income to live on. You're not both being bankrupted by one person's care needs. This is one of the most important protections in the system, and yet so many people don't know about it. They lie awake worrying that their care costs will destroy their spouse's financial security, and it's not true. The system has thought of this. The system protects your partner. Now, let me tell you about Bruce and Jenny. I want you to meet them properly this time because their story illustrates what we're talking about. Bruce is 79. Jenny is 77. They've been married for 55 years. They live in a 3-bedroom home in the outer suburbs that they bought in 1975 for $42,000. It's now worth about $600,000. They own it outright, no mortgage. Bruce worked as a truck driver. Jenny worked part-time in retail until the kids were grown. They both get the full age pension. They've got about $50,000 in superannuation between them. They've got a 12-year-old car. They've got maybe $8,000 in the bank. That's it. That's their financial situation. Last year, Bruce had a stroke. He recovered partially, but he can't walk without a frame. He can't manage stairs. He gets confused sometimes. Jenny's been caring for him at home, but it's becoming too much. She's exhausted. She's 77 years old, and she's lifting him, showering him, managing his medications. She's hurting her back. She's not sleeping. She knows it can't continue. The doctor suggests residential aged care for Bruce, and that's when the fear hits Jenny like a truck. She thinks, we don't have any money. We can't afford aged care. Those places cost hundreds of thousands. We'll have to sell the house. Where will I live? What will happen to me? She's terrified. She's crying every night. She can't even bring herself to start looking at facilities because she's so scared of what it will cost. But here's what actually happens. Jenny talks to her GP. The GP refers Bruce to an aged care assessment team. They do an assessment. Bruce is approved for high-level residential care. He needs it, no question. Jenny starts researching. She's dreading finding out the costs. She looks at a facility near their home. Nice place, clean, good reputation. She calls them. She asks about costs. She's told the accommodation price is $350,000. Her heart sinks. She thinks, we're finished. We can't do this. But then the facility asks about Bruce's financial situation. Jenny explains. Age pension, minimal super, family home, modest savings. The facility says, okay, he'll likely be a supported resident. Let's get his financial assessment done. Jenny fills in the forms with help from MyAgedCare. They assess Bruce's situation, and yes, he's classified as a supported resident. His accommodation is fully subsidized by the government. He pays nothing for his room, zero. His only cost is the basic daily fee. That comes out of his age pension. It's around 85% of the base pension amount. So he's paying roughly $50 a day from his pension. The rest of his pension, about 15%, is kept for his personal expenses, toiletries, treats, outings. Jenny is stunned. She can't believe it. She'd convinced herself they'd have to sell the house, that she'd be homeless, that Bruce couldn't get care, and none of it was true. She keeps the family home. She keeps living there. It's protected because she's still there. She keeps her own age pension. She keeps the small amount of savings they have. She visits Bruce every day at the facility, and their financial situation is basically unchanged. Bruce gets excellent care. The facility is clean and well-staffed. He's in a shared room, not a private suite, but he's comfortable. He's safe. He's being looked after by professionals, and it's not costing them their life savings. Now, Jenny still has challenges. It's heartbreaking having Bruce in care. She misses him being home. She feels guilty sometimes, even though she knows this was necessary. But the financial terror she felt, that's gone, because she learned what the system actually offers. This is the reality for many Australians. If you have minimal assets and you're on the age pension, you are supported. You are not left behind. You are not denied care. The government subsidy covers your accommodation and care. You pay a modest daily fee from your pension, and that's it. Now, let's look at a slightly different scenario. What if Bruce and Jenny had more assets? What if they had $200,000 in super instead of $50,000? What if they owned an investment property? Would Bruce still get care? Yes, but his costs might be different. With more assets, Bruce might not be fully supported. He might have to pay part of his accommodation costs, maybe $50,000 as a lump sum, or maybe he'd pay a daily accommodation fee. He'd also likely have a means-tested care fee because his assets are higher. But even then, there are caps, annual caps on how much you pay, lifetime caps, so you're not paying forever without limit. And importantly, Ginny at home is still protected. Their family home is still protected while she lives there. She's not impoverished. The system scales. The more you have, the more you contribute. But it never takes everything. It never leaves you or your spouse destitute. There are always protections in place. Now, what about people who have significant assets, but it's all tied up in their home? This is surprisingly common. You bought a house decades ago in what's now an expensive suburb. It's worth $1 million, but you're living on the pension. You're asset rich, but income poor. What happens then? First, remember the home is exempt while your spouse lives there. So if your partner is home, you're assessed without the house initially. But let's say you're single, or your spouse has also moved to care. Now the house counts, but it's capped at a certain value for means testing. You might be assessed as having to pay accommodation costs, but you don't have to sell immediately. You can pay a daily accommodation fee instead of a lump sum. You can take your time deciding whether to sell, rent it out, or keep it. Some people do choose to sell. They use part of the proceeds to pay the accommodation deposit. They invest the rest to generate income. Some people rent out the house. The rental income covers the daily fees and gives them extra income. Some people do what's called a family agreement, where an adult child lives in the house and helps manage costs. The point is, even if you have a valuable home, you have options. You're not backed into a corner. You're not forced to make rushed decisions. The system allows time and flexibility. Now let's talk about something that causes enormous stress. What if you're already in aged care, you're paying fees, and you run out of money? Maybe you paid a large accommodation deposit and now your savings are running low. Maybe you've been paying means-tested fees and your investments have dropped in value. What happens? Do they kick you out? No, they do not kick you out. Once you're in care, you're in care. If your financial situation changes and you can no longer afford your fees, you notify the facility and Services Australia. Your situation is reassessed. Your fees are adjusted based on your new circumstances. If you become unable to pay, you may be reclassified as a supported resident. You do not get evicted from aged care because you ran out of money. This is a crucial protection. Aged care is not like renting a house where you can be evicted for unpaid rent. It's a care arrangement, and there are strong protections for residents. Now, I want to address another fear. What about the quality of care? People worry that if they're a supported resident, if the government is paying, they'll get worse care. They'll be in a bad facility. They'll be neglected. Is that true? The short answer is no. All aged care facilities in Australia must meet the same quality standards regardless of whether residents are supported or paying privately. The aged care quality standards apply to everyone. Facilities are accredited and inspected. They can lose their accreditation if they don't meet standards. This applies whether you paid $300,000 or nothing. Now, does a supported resident get exactly the same room as someone paying full price? Maybe not. You might be in a shared room instead of a private room. You might not have an in-suite. The accommodation might be more basic, but the care itself, the nursing, the meals, the safety, the dignity, that's all protected by law. It's all the same standard. And here's something else. Many facilities have a mix of supported and private paying residents. You might be in the same facility, eating the same meals, attending the same activities, receiving care from the same staff. Your financial situation doesn't determine your care quality. The regulations do. So, let's talk about solutions. Let's talk about what you can actually do right now to prepare yourself and remove this fear. Solution 1. Get assessed early. Don't wait until there's a crisis. If you're in your 60s or 70s, talk to MyAgedCare. Understand how the assessment process works. Know what your options are. This isn't committing to going into care. It's just information gathering. Knowledge removes fear. Solution 2. Understand your financial position. Sit down and list your assets, your home, your super, your savings, your car, everything. Then look at your income, your pension, any part-time work, investment income. Know where you stand, because that determines what you'll pay if you need care. If you don't know how you'd be assessed, talk to a financial advisor who specializes in aged care. They can model your situation. They can tell you whether you'd be a supported resident or what your likely costs would be. This removes the terrifying unknown. Solution 3. Plan for different scenarios. What if you need care, but your spouse doesn't? What if you both need care? What if you're single? Think through each scenario. Talk to your family about it. Make sure everyone understands your wishes and your financial situation. This is hard. Nobody wants to imagine needing aged care, but planning for it reduces stress when the time comes. It means decisions can be made calmly instead of in crisis. Solution 4. Consider your home. If you own a valuable home, think about what you want to happen with it. Do you want your children to inherit it, or would you rather use it to fund better accommodation in aged care? There's no right answer. It's about your values and priorities. Some people decide they'd rather sell and use the money to secure a private room in their preferred facility. Some people want to keep the house for their kids no matter what. Some people plan to rent it out. Talk it through. Make a plan. Write it down. Solution 5. Look at aged care facilities now. Don't wait until you need one urgently. Visit a few. See what they're like. Talk to staff. Talk to residents if you can. Get a feel for what's available in your area. This demystifies it. It makes it less scary. And ask about costs. Ask what they charge for accommodation. Ask what the process is for supported residents. Most facilities are happy to explain. They want you to understand. It's not a secret. Solution 6. Understand the safety nets. Know that if you can't afford care, you will still get care. Know that the government subsidy exists. Know that there are protections for your spouse. Know that there are caps on fees. Write this down if you need to. Put it somewhere you can see it when you're worried. The fear often comes from not knowing, so the solution is knowing, really knowing. Not just hoping it will be okay, but understanding how the system actually works. Solution 7. Get legal and financial affairs in order. Make sure you have an enduring power of attorney, someone you trust who can make decisions if you can't. Make sure you have a will. Make sure your super beneficiaries are up to date. This isn't just about aged care. It's about being prepared for whatever life brings. Solution 8. Talk to your family. This is hard, but it's important. Tell your adult children what your wishes are. Tell them where your important documents are. Tell them your financial situation, at least broadly. This means they won't be trying to figure everything out in a crisis. Many people resist this because they don't want to burden their kids. But here's the thing. Your kids are going to be involved whether you prepare them or not. Wouldn't you rather they knew your wishes and had a plan instead of guessing and stressing? Solution 9. Stay healthy as long as possible. I know that sounds obvious, but it matters. The longer you can stay independent, the longer you delay or avoid needing aged care. Exercise, eat well, stay socially connected, manage chronic conditions, fall prevention. All of it matters. This isn't about denying that you might need care. It's about maximizing your healthy years. Every year you stay well is a year you're not paying aged care fees. It's a year you're living in your own home. That's worth a lot. Solution 10. Know where to get help. MyAgedCare is your starting point. They're the gateway to aged care services. They can assess your needs, they can explain the system, they can refer you to services. Their number is 1-800-200-4688. Save it. Know it exists. There are also aged care financial advisors, people who specialize in this exact area. They can help you navigate the fees, understand your options, make strategic decisions. Yes, they charge for their services, but for many people, the peace of mind and the potential savings make it worthwhile. There are also free services, Commonwealth CareLink Centers, Older Persons Advocacy Network, Dementia Australia, Carers Associations. Many organizations offer free information and support. Use them. They exist to help you. Now, I want to address something directly. Some of you might be thinking, what if I need care and I genuinely have nothing? No assets, no savings, barely getting by on the pension. What then? Then you are exactly the person the safety net is designed for. You will be a supported resident. Your accommodation will be fully subsidized. You will pay the basic daily fee from your pension, but that's designed to be affordable. You will access care. You will not be turned away. And if even the basic daily fee is a hardship, there are hardship provisions. You can apply for a fee reduction. The system can assess whether you're experiencing financial hardship. If you are, your fees can be reduced further. Nobody is left without care due to absolute poverty. This is the commitment Australia has made. Everyone who needs aged care gets aged care. Your financial situation affects what you pay, but it doesn't affect whether you get care. That's guaranteed. Now, let me address a painful reality. The system isn't perfect. There are problems. Wait times for assessment can be long. Some regional areas don't have enough facilities. Some facilities have quality issues. The sector is under-resourced in some ways. Staff are overworked. I'm not going to pretend everything is perfect. It's not. There are real problems that need fixing. But the core question we're addressing today is about affordability. And on that front, the protections exist. The safety net is real. You will not be denied care because you can't pay. The quality of that care, the wait times, the experience, those are separate issues. They matter enormously, but they're different from the question of whether you can afford it, and I want you to understand that distinction. So, where does this leave us? Let me bring this together. If you can't afford aged care in Australia, here's what happens. You get assessed based on your assets and income. If you have minimal assets and income, you're classified as a supported resident. The government subsidizes your accommodation and care. You pay a basic daily fee that's affordable on the pension. You get access to care. Your spouse at home is protected. Your family home is protected while your spouse lives there. You're not denied care. You're not left without options. If you have some assets but not enough to pay full costs, you pay what you can. The system scales, but there are caps, there are protections. You're never paying without limit. And importantly, once you're in care, you stay in care even if your money runs out. This is what the system is designed to do. It's not perfect, but it's not the nightmare scenario that many people imagine either. The fear is usually worse than the reality. And here's what I want you to take away from this. You are not going to be abandoned. You are not going to be left suffering without care because you can't pay. The system has protections. The safety net exists, and you need to trust that. Now, let's talk about what this all really means, because we've spent 30 minutes talking about fees and assessments and regulations, but that's not what this is really about. This is about your dignity. This is about knowing that you're going to be okay. This is about removing the terror that's been sitting on your chest every time you think about the future. This is about letting go of the fear so you can actually live. You've worked your whole life. You've contributed. You've raised families. You've paid taxes. You've been part of this society. And now, in the stage where you need support, the society has systems in place to support you. That's not charity. That's not a handout. That's the social contract working the way it's supposed to. You're allowed to need help. You're allowed to need care, and you're not a burden for needing it. You're a human being who's reached a stage where your body needs more support than it used to. That's not failure. That's life. And your value as a person isn't measured by your bank balance. It's not determined by whether you can afford a private room or luxury accommodation. You are valuable because you're a person. You deserve care and dignity regardless of your financial situation, and the system recognizes that. I know some of you are still worried. You're thinking, but what if? What if the system changes? What if the government cuts funding? What if the protections disappear? I understand that fear, but here's what I believe. The fundamental commitment to aged care for all Australians is too deep to disappear. The political cost of abandoning elderly Australians would be enormous. The protections might change in details, but the core principle that everyone who needs care gets care, that's not going away. So, what do you do with this information? First, you let go of the paralyzing fear. Not all fear, because some caution is healthy, but the terror that stops you from planning, that keeps you awake at night, that makes you feel hopeless, that can go. Second, you make a plan. You assess your situation. You understand your options. You talk to your family. You prepare as much as you reasonably can. And then you let it go. You've done what you can. You've planned. Now you live. Because here's the thing, You might never need aged care. You might stay healthy and independent right up until the end. Many people do. Or you might need it briefly. Or you might need it for years. You don't know. None of us know. But what you do know is that if you need it, the system will be there. Imperfect, yes. Complicated, definitely. But there. And that's enough. That's enough to let you breathe. That's enough to let you focus on living instead of constantly worrying about what might happen. This is your third act. These are the years you've earned. These are the years where you get to focus on what matters to you. Relationships, experiences, peace, joy, whatever that looks like for you. Don't let the fear of aged care steal these years. Don't let the worry about costs rob you of your present, because that's letting fear win. And you're bigger than that fear. You're stronger than that fear. And now you're more informed than that fear. You have knowledge, you have options, you have a plan, and you have the understanding that no matter what happens, you will be okay. Not necessarily in exactly the way you'd prefer, not necessarily without challenges, but okay. Cared for, safe, dignified. That's the promise. That's what the system is designed to deliver. And that's what you deserve. So take a breath. Let your shoulders drop. Let the fear ease. You're going to be all right. And now you know why. Thank you for listening. Remember, this is general information only, not personal advice. Always seek professional guidance for your specific situation. But I hope today has given you clarity. I hope it's given you peace. And I hope it's given you permission to stop worrying quite so much and start living quite a bit more. You've earned that. Go and enjoy it.